after, I'm going to send out a follow-up email with a link to this recording, as well as the PowerPoint slides, a link to resources talked about in this session, a link to our websites, and a survey link as a component of the PDG New York State B5 grant. The grant requires data collection and feedback on all activities. So we ask that you pay attention to that follow-up email and please participate in that survey. Additionally, please remember to mute yourself and put any questions in the chat. I'll be monitoring that, and we'll have a couple minutes at the end of the session to go over questions and talk with our presenters. At this point, I'm going to turn it over to Sonia Murdoch, the Executive Director of the Postpartum Resource Center, and she's going to share some remarks about her work and the HVCI's collaboration with Schuyler Center for Analysis and Advocacy and the MomD Moving on Maternal Depression webinar series for this session.
Great. Thank you, Maggie, and welcome to everyone for today's webinar hosted by Prevent Child Abuse New York and the Schuyler Center for Analysis and Advocacy in partnership with the New York State Home Visiting Coordination Initiative and the Postpartum Resource Center of New York. We're excited to offer the Home Visiting Coordination Initiative with support from the Moving on Maternal Depression webinar series, presenting this overview on New York State resources, the Growing Up Healthy Hotline, and the New York State Parent Portal. The Moving on Maternal Depression webinar series is co-hosted by the Schuyler Center for Analysis and Advocacy and the Postpartum Resource Center of New York.
You're on mute.
Sonia, you're muted.
Okay, thank you. On behalf of Bridget Walsh, Senior Policy Analysis and the Schuyler Center for Analysis and Advocacy, I share with you that the Schuyler Center is a statewide nonpartisan advocacy organization primarily focused on improving policies for those living in poverty, particularly children and families. The Moving on Maternal Depression Project works in part of their continuing efforts to connect and improve care and resources for pregnant and parenting women and their children. Moving on Maternal Depression was part of a national learning collaborative to advance policies that improve prevention, screening, and the treatment with an emphasis on racial equity and culturally relevant practices in policy and systems management. Here in New York State, we expanded the focus to include maternal mental health more broadly. While the national project has wrapped up, we continue to develop a state-level learning collaborative that can share best practices and information on maternal mental health issues here in New York. One of the projects for the Moving on Maternal Depression Initiative is this webinar series. And to share with you briefly about the Postpartum Resource Center of New York, who is a co-host of the MomD webinar series. The Postpartum Resource Center of New York helps New York State moms, dads, and families get to the help they need for perinatal mood and anxiety disorders, helping families since 1998. Our statewide toll-free helpline is available 7 days a week with additional support from Moms on Call and family telephone support. Online, we have free access to our statewide perinatal mood and anxiety disorders resource directory. We offer education on perinatal mood and anxiety disorders through our training institute, including our Circle of Caring support group program and various initiatives such as our Vision, Project 62, the Lisa Mary Riley Visioning Educational Series, and Take Care of You initiative. We want to use this webinar series as a way to bring together professionals in the field who are also addressing perinatal mood and anxiety disorders and grow this network. So at this time, I'll pass it back to you, Maggie, who will now introduce the first presenter. So thank you to everyone for joining us today. Thank you.
Thank you very much, Sonia. I now have the pleasure of introducing Lucinda Caruso and Anne-Marie Mistretta, who are presenters on the New York State Growing Up Healthy Hotline. And Sonia, I believe you just have to stop sharing so Lucinda can go ahead and bring her PowerPoint up. Perhaps Lucinda has stepped away. Oh, there you are. You're on mute.
I'm here. Let me get this slide deck up. Trying to share my screen. All right, are you able to see my screen?
Yes.
Okay. Well, I will get this presentation started. Maggie, do you know if Anne-Marie has joined us?
I don't see her in the participant list, but if she joins, I can make her a co-host.
Okay, I will try to do my best. So good afternoon. My name is Lucinda Caruso. I'm with the New York State Department of Health, and I lead the home visiting unit here. And I want to thank Maggie for inviting myself and my colleague, Anne-Marie Mistretta, who I hope will be joining us shortly, to speak with you today. Anne-Marie is the contact center manager for the Goodwill of the Finger Lakes, and she oversees the Growing Up Healthy Hotline. So we believe the Growing Up Healthy Hotline is an underutilized service, and we'd like to get the word out amongst providers who take care of families in New York State. So this is a brief outline of what we intend to cover during the presentation. We want to talk about what is the Growing Up Healthy Hotline? How does it work? So when you call, what happens? What information can the hotline provide to callers? And how you get a hold of the hotline. So the Growing Up Healthy Hotline is a 24-hour-a-day, 7-day-a-week service intended to assist those who are pregnant or parenting in New York State. It's been in existence for decades. Trained call center representatives are able to answer questions about programs which promote family health. Some common questions that callers ask are, how can I get health insurance? I've lost my job and I'm pregnant. How do I get help? And how can I use my farmer's market benefits? So as the recipient of the Maternal and Child Health Services Block Grant, also referred to as Title V, the New York State Department of Health is obligated to provide a toll-free hotline and assistance in applying for services to those who are pregnant, infants, those who have infants, and children who are eligible for Medicaid. Goodwill of the Finger Lakes has been the contractor for the Growing Up Healthy Hotline since 2008. So Growing Up Healthy Hotline representatives rely on a database of services drawn from the websites of state agencies, primarily the Department of Health. Representatives are able to provide contact information on these services, hours of operation, address, and phone number. So at this point, I was intending to turn it over to Anne-Marie. Maggie, do you see her in the participant list at this point?
I do not, and I did just send her another email with the Zoom link.
Okay, okay. Do you want me to proceed, or do you want me to pause and we can come back to this? Or is it up to me?
It's up to you.
Okay. All right. I will try my best to cover for Anne-Marie.
Okay.
All right. So the way the hotline works is we have operators that are available, as I mentioned, 24 hours a day, 7 days a week. They can call the hotline at these numbers. And the operator who answers the call, it's always a live person who responds to you, will provide contact information for local resources. So the hotline has a large directory of resources by zip code, and they are able to connect you with whatever services you may need. And these are some of the services that they can connect callers to. So a common question that people ask about is, how do I sign up for WIC, or where is my local WIC agency? Is my local WIC agency currently open? What are the hours of operation? So certainly nutrition and food support is a very common topic for callers. Obviously, clients call about health insurance. How do I sign up for health insurance? And we also have a listing of services for parents of children with special health care needs. So that is a directory, again, that the Department of Health supplies to the Growing Up Healthy Hotline. Callers may call about family planning services, STD testing, any kind of health care before, during, or after pregnancy. They do get calls from those who are pregnant and need to be connected to an OB provider in the area, so they have that information. And any sort of health services for newborns and infants are also resources that they can provide to callers. So in the past couple of months, we did develop a hotline flyer. So this is a flyer that is posted to the New York State Department of Health website, and I did supply the link to Maggie so she can share this following our call. So this hotline is intended for folks to pass out, either electronically, share with clients, or to share in person if that's how you're providing services. To again, let folks know the scope of what the Growing Up Healthy Hotline can provide and the contact information for them. So the Growing Up Healthy Hotline did receive over 10,000 calls, and that's for a 9-month time frame last year during the pandemic. And we did notice an uptick in calls during the pandemic. You can see this time frame for the data is January 1st through September 30th, but we've seen an uptick since the beginning of the pandemic, and we think that maybe because people are feeling isolated and it's harder to get a hold of resources, where they may not have access to the internet at home. So the hotline is available to them. The most commonly discussed topics on the hotline are, as mentioned, WIC, Medicaid, farmers market nutrition programs, either or generally, through the WIC program, social services, if people need to be connected to, say, TANF programming, or need to know about other types of social service programs, and also early intervention. If they're identifying an issue with their child and want some early intervention services, the Growing Up Healthy Hotline representatives can connect them with early intervention in their county. So callers are most commonly from downstate, not surprisingly, given the population patterns in New York State. So Brooklyn, Queens, and the Bronx are the most common counties that callers call from. And the Growing Up Healthy Hotline can supply services in numerous languages through a language line. So the most common language that is spoken on the calls is English. However, they very commonly offer Spanish services and have someone who can speak Spanish who's available at any time, but they, as I mentioned, can also supply services in other languages through an outside service. So what we really wanted to convey to everybody on this call is the existence of the hotline. We think that a lot of folks don't know about it. We wanted to let you know that we do make every attempt to keep the directory of resources up to date that the Growing Up Healthy Hotline representatives will cover in their calls. But if you have other ideas about what resources might be covered or might be asked about during a call, please let us know about that. And a common question that we face is, what is the difference between the Growing Up Healthy Hotline versus 211? And Anne-Marie Mastretta, who's not with us right now, but she has a supervisor who oversees 211 programs. And so she got the information back that 211 tends to be more local resources, whereas Growing Up Healthy Hotline tends to be more services that are available statewide. But something they have in common is either resource will have access to information if folks are in crisis, are facing, issues of psychological crisis, concerns about suicide or child abuse. I mean, these are, contacts that either 211 or Growing Up Healthy Hotline can make for you. So at this point, we'll open it up to questions. And if there's any questions I can't answer, I will bring them back to the Growing Up Healthy Hotline and get back to you. Thank you.
Thank you very much, Lucinda. Although Anne-Marie wasn't able to join us this morning, I believe you shared a comprehensive kind of snapshot of the Growing Up Healthy Hotline, and our goal, as you mentioned, our aim for this session was to just bring more awareness and explain the Growing Up Healthy Hotline in more detail for folks. I have a question in the chat about, does the Growing Up Healthy Hotline provide resources on safe sleep? Or could it?
I don't know that one. I can get back to the folks who asked the question. So, and I'm wondering if there might be resources that folks on the call can recommend that we can check the Growing Up Healthy Hotline directory against.
Also, we can save room at the end of the presentation for more questions as well if Anne-Marie hops on the call a little bit later. Another question is information about home visiting programs available?
Yes, so the Growing Up Healthy Hotline has been provided with keywords which would indicate that a caller may be interested in home visiting or benefit from home visiting. And they do have information about home visiting programs across the state.
Just waiting if a couple more questions trickle in. Well, thank you very much. And yes, Laura, there is a website in the follow-up email. I will include a link to the Growing Up Healthy website and the New York State Parent Portal. And with that, it's a transition. Thank you again, Lucinda. I'm going to now turn it over to Cate Teuten Bohn and Sierra Norwood to present on the New York State Parent Portal.
Thanks, Maggie. So today, my name is Sierra Norwood, as Maggie just introduced, and I will be presenting on the New York State Parent Portal website and mobile app and media campaign, which is a part of the NYS Birth Through 5 grant that the council has. Here is our agenda for the day. We're going to do an overview of the Parent Portal website, which covers the Child Care After School Home Visiting Locator tool, the Multiple Systems Navigator, the Parent Guide, and Every Student Present. We'll also take a look at our New York State Parent Portal mobile app, and then we'll share our contact information so you can ask us any questions. While we're presenting, please feel free to ask questions in the chat box as well, and we will go over them. So this is what our Parent Portal website looks like. Cate is going to take us to the actual website so we can walk through it. So the Parent Portal website houses our 4 websites that the council created with families in mind. We put them all in one convenient location to help parents with parenting tips and locate resources that might be helpful to them on their parenting journey. So the first website on the Parent Portal is the New York State Child Care After School and Home Visiting Program Locator. On this website, you will see this map on your screen where you can type in any address, whether it be work or home, and you can see the different child care after school programs and home visiting programs that are located near you. They are listed here on your right. You can click on one and see how far it is away from you by car. We've actually linked this website for available compliance history and current status that is updated routinely. It also shows our capacity information, and it gives you the phone number and the website and the county and the address that the child care after school program or a home visiting program might be located in. When you click on the after school map, you will have the same mapping feature where you can enter your address and you can look for different after school programs that are near you. Again, it shows you how far the after school program is based on the address that you put in by car. It gives you the address, the telephone number, the county, and the amount of children that are served in those programs. The same can be done here for home visiting programs. This home visiting map was created by the council as well, and you can look at the different programs that are available in each county by clicking on the different colors of this map. So now we're going to go back to the Parent Portal and take a look at, I just lost my screen, Kate. I'm not sure if everyone else did.
Cate may just have to reshare her screen again.
There we go. Thank you, Kate. So now we're just going to go back to the Parent Portal and go over the next website that we have, which is the New York State Parent Guide. So on this website helps parents throughout their parenting journey for children birth through to 5 years old. And you can click on the different sections where you are in your parenting journey, whether you're an expecting parent, a new parent, and this parent guide website also doubles as a book, which can be downloaded from the website as well. There are different tabs that we have, the first being growth and development. And the growth and development section of this website looks at different resources and different stages depending on where you are in your pregnancy or your parenting journey. So parents can look at the age of their child and click on these different topics to learn more about how they can support their child through child development, parenting at different stages, nurturing your child, protecting your child, communicating with your child during their different stages of their age, supporting their learning and curiosity, and then their knowledge of child development as well. And there's resources for each of these tabs. The next is the Nurturing Family tab that's available on the Parent Guide website. And this talks about being a resilient parent, what makes a strong family, the importance of social connections and having a support system in your life while you're parenting, and how important it is to have knowledge of child development because you are your child's first teacher. And then we have parenting tips. On this section of the website. So it goes over the 5 parenting behaviors that you want to take a look at that include nurturing your child, protecting your child, guiding your child, communication, and supporting their curiosity and learning, which are also on each of the growth and development pages. And it has little fun facts like, did you know, that you can also learn about and look at when you're looking at your child's development as well. This is a unique section on the Parent Guide website. It is an e-journal, so you can document your parenting journey as you go along. There are question prompts on this section of the Parent Portal website, and there is an emergency contact section where you can create your list of emergency contacts in your support system. And it is really helpful when you are following up after doctor's visits, or you're just having thoughts about how much your child has learned and has grown. In this last tab on the Parent Guide website is a resource tab, and it has resources that range from different categories, everything you would need related to that parenting journey from ages birth through 5 years old. We actually collaborated with all of our state agency partners on this section of the Parent Guide, so we know that the information in these categories is vetted and complies with all of the other state agency guidance that exists on the topics as well. I'm not sure if Cate is talking on this website. If you are, you might be on mute, Cate. I can go over the Multiple Systems Navigator as Cate is connecting to audio. So the Multiple Systems Navigator is one convenient place that has helpful health, education, and human service information for families that have children with disabilities. And on this website, we have the same kind of different tabs that we had that we just looked at in the Parent Portal website, but we have navigating the basics, navigating complex situations, resources, news and events, and tools and mapping. A unique part of this website that I really love is the terms and acronym section. When you are having different service providers and different services for your children, there are a lot of terms and acronyms that are thrown around. So this dictionary helps you to look them up, and then you're aware of all of the different languages that are being spoken and the different terms that are being applied when you're at all of these different appointments.
Sierra, is this meant to be Cate's portion of the presentation?
Yeah, I think so, but I can't seem to hear her. It says connecting to audio on my end, but I can go over it too. This is the Every Student Present website, and this website is supposed to encourage attendance of children from an early age. And there are different sections of this website as well. We have different tabs for boosting your child's confidence, keeping them on track, and keeping your child healthy. Cate, can you click on the different tabs? Okay, so for boosting your child's confidence, we have some tips and resources here that help you with stress and worry, reducing stress, coping with change, and dealing with shyness, which are some of the common issues that are seen when children are first starting out in the early years of school. We also have keeping children on track, And here we have other resources about helping your child succeed in school, common school problems, promoting habits of learning, meeting with your child's teacher, and dealing with a child that might refuse to go to school because there's other things going on. And then the Keep Your Children Healthy section talks about food allergies, vision and learning difficulties, oral health and learning difficulties, what to do when your child gets sick, because there are parents that aren't sure about that information. So this is a helpful guide for that when you have concerns about asthma and building resilience, as well as dealing with the flu. And the last section of this website is protection against bullies. And this talks about confronting bullies, signs of bullying if your child isn't talking about it, and ways to prevent bullying, and it addresses cyberbullying as well.
All right, thanks, Sierra. Can you hear me now?
Yes, we can.
Okay, great. Sorry about that technical difficulty. The parent portal also has COVID-19 resources. We put this page up special in March of 2020 on the 23rd of March. And we have looked at our analytics, and we had people staying 12 minutes on this page. So we have resources here for parenting and homeschooling, or looking at ideas for going outside. But we've also tried to include resources for parents who might have a child in special education or might be having a mental health crisis. And there's also a downloadable PDF for folks. The About Us tab talks about the state agency partners and advocates that we have partnered with in the past few years to build these websites, as well as for the New York State Birth to 5 grant that is funding pulling together these websites and the building of the mobile app. We also have a resources page, resources to help parents, and these are the family engagement, the parent pages from each of our state partners and advocate statewide agencies. And we are happy to add more here, but we did want to look at some of the ways we could help parents in their parenting journey. We mentioned the media campaign just briefly in the beginning. You may have seen these posters in the mall or on billboards before COVID. Last year we changed our media campaign to be about digital, mostly digital media and search. But these posters are available in many different languages. You can print them out today and put them up in your clinic or your hallway so that people can see the different languages that are available. And we also have, of course, a feedback loop for suggestions or questions. And we do have staff who receive this email and respond to it on a weekly basis. All right, so I'm going to go back to our PowerPoint, and we have a parent portal app, and it looks like the website. It has all of the same features as the website, and it's mobile friendly, so you can do all of the same things that Sierra and I showed you. Mostly Sierra's showed you on the website. You can look for all that information. If a parent's phone or caregiver's phone is set to their first language, such as Bengali or Spanish, the app will be portrayed in that language. And we also are working to have push notifications based on the user's preference. They would come in, they would have the tips, the helpful hints from the website with a link back to the website. We hope to include videos and pictures so that it's very engaging. It would be based on the child's age, so we would be sending age-appropriate growth and development information and parenting tips. We are still working on that with contractors now, and it's a very exciting part of the B5 grant.
And we also have a social media toolkit for our mobile app. I just put it in the chat box. We do have it available in English right now on our CCF website. And there are pictures from the mobile app and ready to post messages. And it includes the information for linking and tagging the council in your posts if you wanted to share information about the parent portal on your own social media platforms. We also got the social media toolkit translated into different languages, and we're working on getting those uploaded to the council's website as well. And here is our contact information. If you have any questions, we also include our social media handles where we do a lot of social media content to encourage people to download the parent portal. And if you have questions in the chat box or questions later, feel free to reach out via email and we'll be happy to talk with you more.
Thank you very much, Sierra and Cate, for that overview. It's kind of nice to go through a deep dive to see all of the different tabs and have an explanation. Now we left some time to open up the floor for questions. Feel free to come off mute or again type them into the chat box. And I was monitoring and I saw some great conversation happening in terms of people sharing ideas about what should be on the Growing Up Healthy resource list. So we have a forum here for questions if folks want to participate. And I have a question, Sierra. I saw that you answered that you do collect metrics on the most clicks or the time users spend on the website. So I was just curious on which resources viewers look at the most, if you have that information on hand.
Sure. I'm not sure what they're looking at most from last month, but as Cate did mention before, we were very surprised when we saw our COVID resources and people were spending 12 minutes at a time on that resource page. And that was at a time when we didn't have any paid media. So from February 1st, we had 0 users on our website, and then we had a jump of hundreds of users back in March when our COVID resources were uploaded there. We do still see some time being spent on those resources, but mostly we do see a lot of downloads from the Talking is Teaching posters that Cate showed you that are located on the website. We've been promoting those the most because they are available in multiple languages and can be printed and used in different early child care settings.
Thank you. And Lucinda did just share in the chat that we've been joined by Anne Marie. So if anyone has more specific questions about the Growing Up Healthy Hotline, she's present to answer them. If there are no further questions, I am happy to give folks some more time back in their day. As I mentioned at the beginning of this presentation, a lot of information, a lot of great resources were talked about during today's session. So in the following days to come, I'm going to send a follow-up email with links, copies of the slide deck, and a link to this recording so you can go ahead and watch it back for an overview and explanation again. As I mentioned, we really would greatly appreciate you filling out the survey that I'm going to send after today's session to fulfill our federal grant requirements. And I just want to say again, a huge thank you to Sonia, to Lucinda and Anne-Marie for putting together their presentation, to Sierra and Cate for today's session as well. I think just this overview and spreading of knowledge about the resources available in the state and all the great work that's been done on the mobile app and the website is really important. So thank you again to everyone, and I'm going to go ahead and close out this session.